Avengers assemble in 3, 2. Hello and welcome to a very special podcast episode. I am Anthony Sitko, co-host of Capes on the Couch, and this is a Mental Health Avengers Age of Access Part 2. We are once again joined by a phenomenal group of friends and co-hosts and cohorts, as it were, of various mental health podcasts. So first I will turn it over to my co-host, Doc Issues.
Hello,
and then
everybody.
We'll go around the room.
Man, this is always fun. I'm glad I was able to be a part of this. So yeah, as he said, I'm Doc Issues. I'm a board-certified psychiatrist and director for an inpatient psychiatric hospital in New Jersey. Yes, that is as fun as it sounds.
And it's always a joy getting to do these episodes with you, Doc. Next, we'll turn it over to Guardians MH. So.
Oh, yeah, we're Guardians MH. My name is Dr. Goku. I am a resident in psychology in private practice, and I am also the clinical director with Guardians MH, which is a 501c3 nonprofit melding mental health and video games.
And my name is Matt. I'm a LMSW, and I'm a mental health volunteer for Guardians MH.
Thank you very much. And Matt, this is your first foray with the Avengers, so welcome.
Thank you.
We'll get you your code name and ID card. Jarvis will get that over to you shortly. Next,
Alrighty.
we're gonna swing it over to Anna from Freudian Sips.
Yes, hi, I'm Anna from Freudian Sips. I am representing me and my co-host who could not make it. That's Bonnie. But we are both licensed professional counselors in Illinois, and we are happy to be here. We could not. I'm using the royal we. I'm happy to be here. I could not make it last time for the Age of Access Part 1, so this is exciting.
Well, glad to have you, and good to have you back here. Next, we'll swing over to Pop Psych 101 and Ryan.
Yeah, thanks so much for having me, guys. I wasn't able to make either of the first two Avengers mental health episodes, and I'm the lone host of Pop Psych 101 now, but we are rebooted and going strong now in the age of quarantine. So happy to be with you guys and talking mental health.
Well, happy to have you here. Thanks so much for coming on by, Ryan. And last but not least, we've got Popcorn Psychology.
I guess I'll start. My name is Ben Stover. I'm a licensed clinical professional counselor. I'm a clinical director of a private practice as well as a therapist at a large police department.
I'm Brittany Brownfield. I am a licensed clinical professional counselor as well, so just a therapist. My specialty, if I want to say that, is child therapy, and I work primarily with kids and teenagers in Chicago.
My name is Hannah Espinoza. I'm a marriage and family therapist. Right now, I just work in private practice in the state of Illinois. Mm-hmm.
Excellent. Well, as I said, so great to have all of you here with us. Some of you returning, some of you new, but all of you do amazing things with your podcasts, and all of you are excellent advocates for mental health. So we are glad to know and be friends with all of you. So this is a follow-up from our last episode that we got together in early February, and we joked that it was the Infinity War of the Mental Health Avengers because there were so few people who ended up ultimately being able to make the session. I think it was me and Doc Issues and Hannah, and then Dr. Goku and Joe from Guardians MH. So we were, it was like half the Avengers had been snapped, but this is the end game now. So we are all back. So you are all on my left, as it were, since I'm totally Captain America here.
Absolutely.
And so if you didn't get a chance to listen to that episode, which you totally should go back and listen to now. So pause. If you're listening to this now, pause and go back and listen to Age of Access Part 1 so you understand sort of what it is that we're talking about. But the crux of that episode was discussing several of the problems with access to mental health. And several of the primary issues that we discussed were professional availability, basically the fact that there are not enough mental health professionals to go around and to cover all of the folks with their individual needs. Insurance, and all of this is largely an American thing because the overwhelming majority of us do operate in the US. And so the insurance issue definitely is a major obstacle. I know Dr. Goku was able to speak to some extent about the Canadian perspective, but by and large, we were coming at it from an American perspective. And then some of the other issues were just, as we were discussing, physical access and whether or not there were, tying in with the professional availability, whether or not there was someone in that person's particular area, and cost and so on and so forth. So the thing is, Age of Access Part 1 was recorded right, or at least released right when COVID-19 was just starting to take hold really in China, and just starting to come to various other parts of the world. And so what we are now recording is in a world that is very different, I think we can all agree, than the world in which Part 1 was recorded and discussed. And so I think we're just going to get right to it then. The elephant in the room. We were discussing problems with access to mental health professionals, and one of the at least proposed potential solutions was telepsych. And I think now, in an age of social distancing, physical isolation, et cetera, we have seen a dramatic increase in telepsych, telemedicine in general. And so I posit to the professionals in the room, what are some of the ways in which the COVID-19 pandemic and social isolation and social distancing have impacted your practices? And how do you think this is going to impact access to telepsych and telemedicine and mental health professionals in general moving forward? And I'm just going to throw that open to basically any of the professionals who want to jump in. We're all on video, so raise your hand so we're not all talking over one another, but I don't know who wants to jump on that grenade first.
All right, I'm on it. So this actually isn't new to me. When I was working in the ER and the director for our emergency service there, we were using telepsych for the past 7 years. And it had to do with the fact that we were covering more than one hospital for our county, and we knew we couldn't split one doctor into 4 people. So it was just easier to do it that way. I will say that it was antiquated compared to the way we're able to do things over the internet now. But I always wondered, why on earth aren't we just doing this much more? I understand for many other parts of healthcare that it's not the same thing. But when it comes to mental health, we're talkers and listeners. That is the bread and butter of what we do. So not just video conferencing, which I do think is a big component to it, but even phone calls, things like that. This is something that has been underutilized for far too long. So the idea that it took a pandemic for us to embrace it completely, well, there's another factor to that I'll let you guys get in on later. But the idea that we, at least in my area where we had been using it, we knew that this could be a major factor in seeing people way before they got to the point that things were totally breaking down around them. So I think this is going to be something that is going to continue to be embraced, because everyone is starting to see that it's not just this quirky thing that a few doctors do. That really was the way some of my colleagues would describe it. Like, oh, you do that thing? Like, no. This is now mainstream, and I think it's going to continue from there.
Yeah. Ryan from PopPsych, by the way, I forgot to fully introduce myself. I'm a licensed clinical social worker and therapist, also in New Jersey. I read somewhere that we've basically had 10 years of progress in telehealth in 2 to 3 months, essentially. That the rate at which now it's accepted and normal. I'll give you an example. I work for a small group practice, still does handwritten notes, if you could believe that. And in 3 or 4 weeks, everything got set up to do telehealth, and we were just a small group practice in a small suburban town. And now I see all my clients from that practice online. So that happened really quick. And obviously some people are adjusting to it. All my clients are adjusting to it, but I think it's for the best. I mean, we were talking before we started recording that it took a pandemic for this to happen, but unfortunately, sometimes we kind of have to kick the industry or the government in the pants to kind of get things to where they need to be. So I'm grateful that now this is as normal as it's becoming, because if this enables us to offer our services to people who, whether they live in rural areas or whether they're homebound or whether their work schedules are all over the place, this is one of the biggest solutions I think on the table for us to be able to spread access to people who need it.
For me, for my own practice, I did do some teletherapy prior to everything going on with COVID, just because some people were a little bit further off. They were in different province. So kind of had to, because I work at a private practice and at a university. So kind of have to juggle both of those. But now everything has moved to private practice and has moved to online. And it's been a struggle to figure out what platform to use, because we want to stay HIPAA compliant. And unfortunately, with everything going on with Zoom, Zoom is not HIPAA compliant. Mm-hmm. It's not confidential. So I kind of had to figure out the best way. And right now I'm using Doxy. That seems to be working out pretty good for now. My practice management software is supposed to be coming out with a teletherapy platform with rolled up in what I use. So hopefully that's going to be coming out in a couple weeks, and it's going to be pretty good. And it's just business as usual. Unfortunately, I feel that there's kind of something missing when I'm with a client face to face compared to being through a screen. I just feel there's just that one little component missing.
And I think clients feel that too. Mm-hmm. I mean, I think that, like, at least in my business, I work in a small agency, and we have gotten to the point where we are strongly encouraging people to do the telehealth. We haven't made it a mandate yet, but I mean, even though I'm strongly encouraging people, most of them still want to come in. And I mean, we obviously have our social distancing rules, and my agency is doing a lot of extra cleaning, and we're taking a lot of precautions to make that still possible for our clients. But clients don't want to abuse that system either, and they prefer to be in person. I mean, they want to come into a place where they know it's their safe place, and it's hard to kind of find a space and a time at home to really have that privacy that they want when they have their sessions. So I think there's a lot with telehealth that we can still refine, and that clients are having a hard time finding that too.
Fortunately for us, it's not something we had the luxury of doing. Our province has been in lockdown for the past 5 weeks or so, give or take. So we're completely barred from seeing anyone.
But I think too how quickly, because I know for the private practice that I work within, it was, I think once the lockdown hit, maybe 3 days in, all the insurance companies finally said, like, yeah, cool, go ahead, do telehealth. It's fine, which just made the access a lot easier. But there is definitely that component that I know a lot of clients that I work with feel is that they do miss that in-person sort of connection. The connection with the body language and everything like that is super important. So I think there in the sense is where telehealth could need to be on.
I was having a conversation with Dr. Scarlett, another of the Mental Health Avengers that couldn't be here tonight, last week, and we were discussing what we felt was missing within the telehealth, and she mentioned something so simple of handing a tissue to a client that's having a moment. It's not something I can do anymore.
Yeah.
You can be like, do you have tissues handy? Can you grab one and say it was from me? But that's it.
Right.
Yeah.
It doesn't have that same impact.
Right.
Maybe not.
Right.
Yeah.
Not quite. It's been an interesting adaptation for me. I'm 100% telehealth right now, and the private practice I'm at has a platform that is HIPAA compliant, so that's something we've had for a while and been able to use that, and it's been helpful. We primarily used it just for supervision and within the company meetings before, but now we're able to use it for client work and insurance approval. We did do some of it for cash clients, but because the insurances wouldn't cover it, we couldn't bill that way, so we officially didn't do it. But the change now has been something that's taken some getting used to, but I've been able to even do some of the more specialized treatments that I do with EMDR and hypnotherapy, been able to do both of those remotely with people and been able to get good results from it. So
wow,
it's
awesome.
moving.
Yeah. I did just realize, because there was a situation that came up. Thankfully, it was a situation where the person was near one of our hospitals, but sometimes patients or clients are in circumstances where they're not exactly in a place that they can talk. So if we're using this and they're at home and it's an abusive environment or whatever, that means they have to come up with something artificial and in a time in theory where they're not supposed to leave. And so we do have kind of a backup where we say, okay, you know what, you can come to our emergency room. We have one designated room where no one else is allowed in there, and they can contact us and we could still do the session, even if technically I'm not in the same hospital, but I could still see that person. So, that's something that I do think about when it comes to seeing patients, especially for initial assessments. The first thing I ask them is, okay, is it okay to talk? Which is something that I usually don't say, but I feel like it's something I've had to really introduce.
Get an idea of where you are, the location, just in case of any emergency is going on. It's for, I think, us as to what we do as a part of our initial assessments or just continuance as well.
For us, one thing we needed to do is we wrote up a completely new consent form for teletherapy with certain guidelines. So making sure that you're in a place where you can talk, that it's confidential as much as possible. And so making sure that they're completely informed with what we're going to be doing.
My practice did the same thing. We just came up with a whole new consent form for people to sign. And so that kind of specifies all those exact things. I think I've been on strictly telehealth for a month. I'm a person who would be more likely to get more sick, more severely ill if I did catch it. So I've been home for a while doing telehealth, and I think there definitely are some parts that I like in terms of being able to see clients who maybe live too far away, being able to see some of my college students, even though they're out of state. I think what has been really, and of course was really easy for them to do, like everything would be if insurance would just go along with things the way that they should in the first place. All they had to do was say yes. So as soon as this stuff happened, they lifted all of the access. So now I have clients, I have some clients that I'm seeing twice a week because it just needs to happen, and it doesn't. But also, it is also hard with some clients who have that, are in an abusive situation or don't have a safe place. So I'm having sessions with people in their cars. Yeah. I have a couple of people who are calling me from their car, and it's like, and I think that for some of those people, having a space to come to really is a relief to even just be in a place that they can even feel a little bit safe. So I definitely miss that part. I think that I totally hate teletherapy. I think I hate it.
Thank you for saying it. Yeah.
It makes me sad. I miss being able to, it's just so different to talk to someone. And also, like, with any glitches, having any glitches like I'm seeing, like, gosh, I think I have maybe like 10 or 12 teenagers / kids. And if they don't talk loud enough, it's like it makes me crazy. Like, it's really frustrating for some of those. And also I've been taking intakes. So I've had, brand new sessions with people I've never met before. And I had 3 of those last week. And I was just like, had a little cry after each session because I was like, I hate this so much. And but on the other hand, it's so nice to see that they just lifted everything. Like, I don't have to get authorization every 10 sessions anymore. It doesn't matter if my college students are out of state. I can talk to people on the phone if I need to. Like, what a relief. And I've definitely lost some clients who just absolutely refuse. And then I have some clients who will only do it on the phone.
Yeah, I've gotten about a quarter. A quarter of my clients have kind of pressed pause.
Yeah.
And I think it's just speaking from a purely egocentric perspective, I think just the stamina of virtual health, it feels like I'm doing twice as much work. My brain is like, I got those like blue light glasses. I've been wearing those like the past week. And it just feels, I mean, to be vulnerable about it, like, I think I've never felt so insecure as a therapist since maybe I was green. In that, like, I leave sessions thinking, oh, did I say the right thing? Like, it's just like whatever the secret sauce is with being with someone in person, where you can kind of like feel their energy or whatever woo-woo stuff you want to think about with it. Like, it's just not there with the online. So I feel like I'm taking more swings than I normally would, but I don't know if I trust after I take them. And I work, not to give too many details, but I work with more intensive cases, and so like that can also feel like you have to problem solve on your feet a lot, and so that I feel a little rockier with like what I suggest, what I throw out there in a way that I haven't felt in like years as a professional. And so I think that there is just something that's just not there with I mean, like, obviously online's better than nothing.
Yeah.
But also that is like, you're missing that little, whatever it is, that je ne sais quoi that comes with being in person that, I'm looking forward to having again, hopefully sooner rather than later, but who knows?
All right. So basically, so what I'm hearing from the professionals is that telepsych has solved some problems and obviously created a whole host of others. I certainly don't think it is woo-woo, as Brittany is saying, to say that telepsych is missing that human connection, that in-person vibe that you can pick up from somebody. I think you would really have to be, someone who looks at such black and white stark terms to ignore the fact that there is something extra with an in-person connection, an in-person session with somebody that you can't get over the internet. But as has been said as well, it's better than nothing. And I think what this ultimately is proving is that there does exist a need for it, but it is not intended, or it should not be intended, to completely replace in-person therapy. But I do think what we've been seeing from not just your comments, but from things that I've been reading online and just in the zeitgeist in general, is that there needs to be a balance, and that there needs to be a supplemental use of telepsych and telemedicine in general for people who either, need that thing right away and can't physically get to somebody, or as has been alluded to, they may not be in a physical location where they can go out to a therapist session. That may be telepsych, again, for one reason or another, is all that they have. And so what I think we need to do moving forward, and again, this is me speaking as a non-professional, but I think there needs to be a balance and a use of telepsych as supplemental to the in-person therapy. And that what I'm hoping, and we can segue into this momentarily, is that the insurance companies, once this pandemic passes, they don't go back to the way things were and say, okay, now you have to be in person, now you have to do this, that they say you can do either or, depending on your needs, depending on the needs of the client and the availability of the professionals. Because I'm sure that, tying into the issue of availability, I'm sure that there are mental health professionals who would be more willing to help clients through telepsych, and that may increase the availability and access to just the overall number of professionals to be able to say, okay, here's another doctor that you can see. Even if they're only taking clients virtually, that's still another option. And that may take some of the burden, mental and emotional and physical, off of the in-person clients or the in-person professionals. So I think that there needs to exist a balance. And I just said on the 2 episodes ago that I know I'm a naive idealist, but I could certainly hope that there are positive changes that come out of this pandemic and that we can work together to establish a new normal once this is over, and that we don't immediately just reset things to back the way that they were, because I think this pandemic is certainly showing a lot of flaws in the system in general. So I guess
I mean, I don't
thoughts.
think clients or certainly professionals, from what we're all saying, like would choose telehealth over in person. Like, I think that maybe there was a conception that it would be overused when it shouldn't be, or something. I don't know. I don't know what the rationale was for insurance companies not allowing it before. Maybe there wasn't one, since it was so easy to just say, yeah, it's cool to do now. But
yeah, just put in different codes.
Yeah.
The billing code and the and the accessory to it, GT, at least as far as I know, has been in there for a long time, because I was told always put it, if you use it, they will reject it, but at least you're acknowledging that you're making
you're documenting it. Yeah.
What's interesting is the personal insurance that I have working through a hospital. I'm part of a union. They advertised telehealth about a year ago, and they advertised it saying, here, use this app. If you ever run out of medication and you need a 3-day supply, let us know. We'll get you connected with a psychiatrist for an acute session, and we'll get you what you need. But
psychiatrists have been able to do it.
Right. But it's the mental health. But now I'm starting to see, and this was before the pandemic, they included not just psychiatrists, they included social workers and other mental health as well, even prior to the pandemic. But once again, I live in New York. That's one insurance out of thousands.
Right.
Because there's been services that are completely tele-based.
Yeah, I was going to say it's a Talkspace, I think.
A couple more.
Mm-hmm.
Yeah, Talkspace is one, I think. And they're entirely text or video conference based.
Right.
Right.
Mm-hmm.
Yep.
And I think one of the other things that I think is good about what's been happening is we also are able to waive our copays for clients, and that I think has really given some of the people that I see the ability to actually reach out if they need a second session. I think that's one of the things that really stops people. And not
especially with all the financial stuff going on right now.
Absolutely. So it feels really nice to be able to say, hey, if you can't swing it right now, we are waiving fees. And I've kind of pretty much just told everybody that, and kind of just have all my people just not paying copays, because it just doesn't make any sense to have them do that. And I think the other thing that has just been, it's just been interesting. I'm also really hopeful that this will move something, or at least open up a door in terms of how easy it was for them to kind of get us all in this place. And I think that even professionally, that I'll probably do like one day a week when this is over, for like clients who have really tricky schedules or who live in the suburbs. Like, I took on a couple of clients who don't live in the city, and I won't be able to see them like once we go back. So I think you're absolutely right. I think I would never choose it over in-person therapy ever in a million years.
But it's a tool to have in the toolbox.
It is.
Right.
And I think that it's really, and it feels really nice to offer people another option.
Absolutely.
Yeah.
Mm-hmm.
And I do think
that
that
services like BetterHelp, Talkspace were so popular for a long time. It's because it's on your time where you can, rather than going to an office. It's much more confidential for a lot of people.
Yeah,
and people really like that aspect.
Yeah, I've had some people with some severe anxiety disorders point out they would not have even sought treatment if it weren't for the availability of some technological access before seeing someone in person.
Right.
So there is another spin to that where it's true that I definitely have noticed there are some patients that just simply say, no, I won't do it. I'll wait for everything to come back. I'll grin and bear it. But there are others who basically said, like, you know what? I was really scared to talk to anybody. And even if it's just on camera or whatever, I know that I'm still in my place and I'm okay with that. So, that's something that I've definitely noticed. And I think there is going to be a little bit of a clawback because pardon me, this is my paranoia coming through. I don't trust that insurance companies are going to continue exactly the way they are. But
sure.
I don't trust insurance
0%.
companies, period. Full stop.
Yeah.
So, as Anthony said, he's the idealist. I'm a cynic, but I've always said, scratch a cynic and you realize there are wounded idealists. So, yeah, I do think that we are on the positive swing. I do think that they're not going to claw everything back, but I think there is going to be almost like I hate to say this, it's almost going to be similar to prior authorizations for medications where it's like, okay, you just need the justification. Why are you using telepsych compared to in-person?
Right.
All right, cool.
Right.
You signed off on it. We're good.
Yep, I think that you're right. Having worked as a manager with a insurance company contract, I got to see a lot of the inner workings of how things go and how they function and think, and it is almost certainly going to revert back to the closest thing that they have sat down with their legal teams and found to be liability proof or liability minimized. Anthony would have to clear that up for us, being the resident attorney here. But the way that they're going to think and the way that they're going to go is going to masquerade as if it's client first, but it's all going to be about protecting their income first and what keeps the most money in their pocket. And yes, they're going to do things to care for clients, but also how do we make money? So keeping that perspective in mind is that I think that there's a lot of things that are going to be things that employers, and when they're negotiating employer contracts, that there's going to be, and unions are going to be coming in with some firepower now that, well, we saw how this worked for our people and our people want it, so you're going to make it happen for us.
Mhm.
And it's going to have to come from that direction because insurance companies function like the military does. If it doesn't come top down, it ain't happening. And it's,
I was watching a news report today. I don't remember exactly sources from the places brothers live. They were saying that when the pandemic is going to be quote unquote over and things tend to go back to normal, people are estimating premiums in the U.S. may go up by about 40% due to how much the insurance companies are giving. And that's going to be passed down to the employer, then down to...
I think you're right. I think everybody's going to see it.
That's going to be a big deal for a lot of people that can barely afford insurance now.
Mm-hmm.
People to afford their insurance.
Well, I think that's a perfect segue then into the next topic. And one of the things that we had discussed very briefly in the problems episode, or part one, was insurance. And so solutions, I mean, God, I think we're going to see this, at least in the U.S. This is definitely going to play out in the presidential election. This is going to be a major topic. And I'm not going to try and get into too much of a political debate, but I will say that I'm confident that this issue is going to be brought up during the debates. It is going to be part of the campaigns. And what I think I've been seeing is a lot of, at least on my end, even and I'm really trying not to get too into the weeds here politically, but what I've been seeing from a lot of, say, the older folks who may tend to skew a little more conservatively is this backlash against the insurance companies and pharmaceuticals for making everything about money and for making everything profit driven. And what I've been seeing in equal measure is the response that if you want to do that, then take profit seeking out of insurance. Then take the profit seeking, then take that incentive away from the doctors, and then they will only do the tests that are needed. They will only give you the medicine that is needed, and they're not going to be in it for making money. And in addition, you will see the doctors and the professionals, and I'm not denigrating all professionals, obviously, but you will see the professionals who are only in it to make a buck. Their incentive is gone, and now they drop out. And yes, that may reduce the overall number of professionals, which increases the burden on the rest of you all. But the overall quality increases because you're not going to see the professionals going after whatever makes the most money. They're not going to be making decisions based on money. They'll be making decisions based on what is best for the client. And so what I think that a lot of what we're seeing in this pandemic is going to help lead towards more of a push towards a single payer system in the United States. And again, I'm not trying to necessarily get into the weeds politically, but I think that one of the things that we are seeing as a result of this pandemic is pushing towards that, because this is exposing all of the flaws in the current system. And not to say that a single payer system is without flaws, but I think that the people who've been suffering the most under the current system are willing to say, you know what, this isn't working. Let's try something different. And it pushes towards that. So as a potential...
I can speak to that a little bit.
I was going to say, Dr. Goku can certainly speak to that from a Canadian perspective.
We have a single payer system in Canada, and it's province and territory based, but it's overarching through the So if we look into mental health specifically, within psychology, for me and my province, there's one fee. Overarching throughout private practice, there's one fee. There's a small leeway. It's between X and Y, and it's about a $20 difference. And you charge within that $20 difference. Most either right in the middle or right at the top. And it kind of stomps the shopping of who is the cheapest alternative and who do you fit in with more.
Right.
And compared to other provinces, so the bigger provinces like Ontario and Quebec, you're going to pay a little more just because the provinces are bigger, the provinces are richer compared to the smaller provinces where the mean income of the residents are lower. So it kind of varies in that way. But for us in Canada, when it comes into the general health sector, is the government negotiates all of the prices for every single supply and gets a lower cost because it's buying for the entire country. So it's big bulk orders rather than the individual orders. I think it's like per hospital or per state. So that's one way that they're keeping the costs down.
So economy of scale.
Yeah.
I think Anthony's right. I think that it's not going to happen fast. It's probably going to take another 10 years is my guess. But the reality that we need to get the profiteering out of healthcare in our country is just flat in the faces of everything. And you see it with access, and you see it with people being uninsured and people having to choose, like how much they can choose to afford on therapy if they don't have insurance, because not every practitioner will do a sliding scale. Some people like, my fee is $150 flat, and you can afford it or you can't. And to see that removed where people can see the provider who is the most qualified to solve their issue would be the way I would love to see things go. Because not the cheapest therapists, like there was a place that Hannah, Brittany, and I all worked at, and you kept running into the constant problem that the most qualified practitioners leave after they get so fed up with dealing with the state insurances and all the things that come with that problem, and the population is very difficult to work with, is that the most qualified practitioners, 80% of them leave, and the other 20% become supervisors and aren't seeing clients as much, or eventually not at all, and they're just guiding policy. But you see that the most chronic people are being seen by the least qualified therapists, because that's who's available, as opposed to who should be seeing them based on their skill set.
So for us in Canada, the way it works is you have what's covered under Medicare and what's not. So if we're looking into psychology and psychiatry, so psychiatry all covered through Medicare, entire thing. When it comes to psychology, you have through the hospital, or you have the community mental health, and then you have private practice. So hospital, community mental health, all covered through Medicare, meaning no one's paying anything out of pocket. It's all covered. It's free, but it's going to cover within your tax dollars. In private practice, because we're elective, people pay for the service, but generally most people have a separate insurance that covers like dental, mental health, physiotherapy, massage therapy, and other things. And that widely varies from client to client. I've had people that have enough coverage for 3 sessions, and I have people that have enough coverage for an entire year.
And imagine having not being paid in a situation where they're paying such a large percentage of their paycheck into premiums, and then also dealing with deductibles that are climbing through the roof. It probably makes even having to purchase a supplemental insurance to do that or pay out of pocket much more reasonable to do.
So first, most insurances are covering 80%. Most plans are 80%, meaning my clients pay about $32 when they do claim through insurance, and we direct bill, so they're $32.
Completely reasonable. Because here we have, not only do people have premiums they have to pay, but they also have to pay the deductible before the plan even starts paying 80%. And some of those deductibles are in the $10,000 or more range.
Oh, yeah.
Mm-hmm.
So not only are you paying for the year $12,000 for insurance, but you got to pay another $10,000 before the insurance will even kick in. So it's garbage.
Yeah.
People are having to choose between they're having to prioritize well, I need this like physical medication, if we can call it that, I guess. Okay, well, I'm going to do that because since I'm paying for that, I can't afford my, mental health medications, and I definitely can't afford to go into a counselor every week. Oh my God. I mean, it's like doing like mental health triage. It's just not working.
Yeah, you pay for the right to pay to get treatment at some point in the future.
Yeah.
It doesn't make sense. And the idea that at this point, I know just about every psychiatrist that I work with and nurse practitioner, we learn the basics of how to bill. And then from there, we realize, we can't dedicate nearly as much time as we should to this. And we therefore have specialized people to deal with that section. And we have them negotiate with the insurance companies, and the insurance companies realized, wait a minute, if they have negotiators, then we need to make sure that we have the proper people to justify why we're not going to cover certain things. And we end up with system bloat. And I know, once again, not to get into the political side, like Anthony said, I think one of the fears, though, that many people have is that that's on the private side with people trying to make a profit that still are willing to put out the manpower just to battle these types of charges. If that's what private companies that do insurance are willing to do, what on earth is the federal government going to do? So that's a fear. I'm not just talking about from some providers that I talk with. I'm also talking about some patients, some clients that basically say, okay, I'm all aboard the idea that I'm going to get coverage from things from day one. That's fantastic. How on earth are you going to guarantee to me that, let's say right now, I just have to deal with my insurance company for a medication, and I could still in theory make up my mind and switch somewhere else or, do some other plan. If it's all just single payer and they say for whatever reason that medication is not appropriate, or that doctor, needs to make 5 phone calls to justify, what am I going to do then? I'm not going to have any other options, or at least that's the view that I hear. I'm not saying that that's right. I'm just saying that that's a concern.
So for here, the way it works is the government deals with everything incoming to negotiate the prices down. Treatment is left up to the practitioner. So what they feel the person should get, as long as it's not excessive, there's kind of that checks and balance in terms of don't recommend 15 different tests when it's not needed. So 1 or 2, figure out, and as long as it goes, but it's left to the practitioner.
Yeah. And I think that sounds like a great solution to some of the issues, and that something I'd like to see here to touch on where you're going with that and where Doc is going is that, again, Hannah, Brittany, and I all worked as part of the system bloat, to be honest with you, our last position. They paid us double what we were making as frontline practitioners to help people learn how to navigate their system better, is essentially the role we had. It makes no sense at all and that bloat is all over because it's not just people who are getting paid to help figure out how to be educated and talk compassionately to people about how to navigate all of the nonsense options they have to go through, but also we need to find a way to reduce that without jeopardizing jobs that people have, because then people are going to start getting upset. But that bloat exists in so many ways that there's not just people who are care coordinating and managing that. There's people who are determining whether claims can be approved or not, and they're pulling practitioners off the lines with money in order to do that, and finding solutions to minimize the need for that so we could have more of those people outside of the insurance company and back on the front lines working with clients would be a huge solution point from my end.
Well, if I could just jump in real quick, then one of the other things that I've been seeing and has been widely discussed as part of this pandemic is the fact that so many people are now being laid off from work. The unemployment claims are skyrocketing week after week. Yeah. At this point, we're going to see potentially 30% unemployment in the United States. And one of the biggest things that I've been seeing, and one of the largest complaints I've been seeing, is the fact that your medical insurance and your health insurance is tied to your employment. And that now with millions of Americans, and again, potentially a third of the country being laid off, not only are you not making money, now you have no insurance, which is a double whammy for so many of these people. And I think, again, that is going to strike in favor of a single payer system, because now you have the health insurance regardless of your employment status, and you have the ability to seek assistance with your mental health problems. In many, I know for many, and it makes sense, being unemployed is incredibly stressful. It weighs on you, and that impacts so many other aspects of your life. And then it becomes a vicious cycle because you're unemployed and now you're stressed, you're anxious. That feeds other problems. Now it becomes more difficult to find a job. So now you still don't have insurance. You can't see a therapist. You can't get the help that you need. And it's a negative, vicious spiral. And I think one of the solutions to that is to separate employment and health insurance. And if you separate them so that you have the health insurance regardless of your employment status, that I think you're going to decrease anxiety in a lot of people, and it's going to help the employers, because now they are no longer required to spend copious amounts of money and look for the cheapest plan and so on and so forth. And they can turn around and put that money back towards their employees and back towards creating a better work environment, rather than spending all of so much percentage of their overhead requirements on providing insurance. So I think that is another solution. But again, that's something that really has to come from the top down. And that's such a heavy political animal that I don't know if and when we're going to see that happen. I certainly hope we do, but
well, and I think it does have to come from the top down, but also from the bottom up. There is this fear of how it works Like, I mean, I think we're talking about the bloat because we see it from the other side, and we see all the costs that are just nonsensical and that we shouldn't have to have, and how this all stacks up. But then there are people who aren't taking into the account that you have to pay $20,000 before anything is covered. And they're saying like, well, how is this going to get paid for? Okay, well, you're going to be paying less. I mean, I think people have this really like visceral kind of like micro fear, not even like the macro, how it's working on the whole social scale. It's like, how is it going to work for my family? And it's just because they don't see how everything's stacking up right now to rip them off, really.
Because for us, the way it works is you pay your taxes every year, and that pays for your health care. You're born with a card. You get the card.
Gee, it sounds so simple.
Covered for life.
Like that.
Sounds nice.
It's nice.
Yeah.
What we've been doing, I also work at a hospital as well as a medical social worker. And what we've been doing, as soon as they come in, if they'll tell us either that they've been recently unemployed or they have no insurance right now. The quickest thing that we're doing is actually applying for them to get onto New York State Medicaid. So we need the proof of being laid off, or proof of being terminated, as well as a few other things. So while that's a solution to helping some people at least remain covered, the thing that needs to change, which once again, this is sort of a top-down thing. I can speak for Staten Island mostly, but also some of the other 5 boroughs as well. Nobody accepts Medicaid. You have to go to a hospital clinic, be it for mental health or physical health, realistically, and get the care there. So now you're dealing with social workers and counselors who have, I think the last I saw, maybe 50, 60 people on a caseload. And some people are not always, and sometimes sessions for Medicaid you can bill for a 15-minute session. And I've known social workers to do that because they have 10 other people waiting for them.
Yeah.
So as far as like a solution for that goes, Medicaid has to be completely reworked in a sense, because you need to have more outside providers accepting it. And I know there's a lot of red tape for people to become a provider for Medicaid and Medicare as well, but that has to be. And I know there's also a little bit of a payment issue too. When private practices go to bill for Medicaid, they don't get as much as they deserve, unfortunately.
Right.
And so nobody takes it.
Less.
Yeah. So everybody says, you know what, I'm not going to deal with the red tape to get certified, nor am I going to deal with the low payment. So I'm not taking Medicaid. And just because I'm a nerd and I look at stats, in December in New York alone, over 2 million people are on Medicaid. That's a lot of people.
And it's awesome that you're helping them do that, but quite frankly, you shouldn't have to do that.
Right.
That's part of that bloat thing, that like that's not your job to help.
No, but it
people do
becomes
that. Yeah.
Right.
And
It becomes
it's
a part
awesome
of my
that you
job.
are, but
Right.
it's like
Yeah, it's that classic. It's not your fault, but it is your problem.
exactly,
Absolutely.
yeah.
Absolutely. The doctors literally will come to me, hey, they have no insurance, get them insurance. Sure. Okay.
They're like, I don't know how feelings reflection my way out of this, man.
Right. So more like it's okay.
Yeah.
Right, and here, I don't know about there. I mean, imagine New York isn't a whole lot different than Chicago. You're bigger, but the things that we have to deal with is if you want to get somebody on insurance that same day, like hospitals, like you're saying, have some more power. But if you're doing that for just somebody in the public who's lost their job and needs to get on healthcare, if you do not physically go to the DHS office, if you mail your application in or if you put it in on the computer, it will take you 3 months for them to process it. Whereas if you go, you're going to be there with everybody from all walks of life who is there just like you, but everyone is going to be there for hours, and it will take you 6 hours to get seen. You'll get insurance probably that day or the first of the next month, depending on when you're there. But
Right.
wow.
So do you have the time to take 6 hours today, or do you wait 3 months?
Correct.
Yep.
And that's really where that's where the solution comes from. It really is, as much as we don't necessarily want to get too political, this weighs heavily on a political sense, because there needs to be somebody as powerful as we are as the Avengers. We do need somebody a little bit more powerful to say, hey, you know what? These people are right. Let's make a few changes to how there's a delivery of service.
And
I was a councilman in a tiny town in New Jersey, so I've got some political pull.
You got some pull.
Yeah. But like you were saying, Anthony, the people that are laid off, lose their job, and subsequently lose their insurance, it plays so heavily on their mental health. And mental health is health. There's no ifs, ands, or buts about it.
Mental health is physical health. Yeah.
Being in that state, certainly within the climate that the world is now, is terrifying for people. It'll come to, do I want to go get tested? Do I want to pay for the test or not, or for the treatment? Or do I just want to, hopefully it won't be too bad?
Exactly. Yeah. Yeah. You're starting to say something, Brittany?
Yeah, this is a little sort of off topic, but just kind of one for me, like be able to pick the brain of having a bunch of, mental health professionals in one area. And two, possibly helpful for whoever's listening to us, is what have been your go-to suggestions, recommendations for the clients you're working with who are struggling with all these things we've been talking about, like stress related to like work instability, or I don't know, everything that's going on in the world right now. Like, has there been any go-to suggestions you've given to clients that's felt helpful? I mean, maybe I'll use them for myself, to be quite honest.
Well, I think that's a wonderful question. I don't think it's off topic at all. And I'm glad you brought it up, because I think it was, certainly on the minds of everybody else here, but thank you for raising that. So,
yeah, I'm going to talk about one thing though, because what I am as a psychiatrist, AKA the pill pusher, or whatever people like to call us now, medications and paying for them is still a huge factor. And I know that ties directly into the insurance thing. So there's two things that I say. One, I know that it sucks how much the pharmaceutical companies gouge for prices of certain medications, but they also need the customers. And so as your local prescriber, I like to point out that most companies do have some form of relief. It may be on their website. I may have information directly handed to me that I print out. I may direct them to, once again, the type of people that are paid specifically to do this on a daily basis within our pharmacy. But the point is, the companies themselves are not completely blind to the idea that things are way too expensive, and there are ways to get around that. There are other things for each state, at least in the country, when it comes to potential relief for medication management. New Jersey RX is an example. Good RX is one of the most advertised ones in the country overall. They make it their business to, report exactly what the lowest prices are. I apologize. I know I'm kind of shoehorning this in, but I just wanted to make sure I got that out there for people that really don't know about it, because it's just that important.
But I actually think it ties into, though, when we talk about anxiety and stress of losing job, not having a form of income, with that comes cost of medication. Some people were taking high blood pressure medication, or we're taking, even if we're stepping away and not talking so much about, antipsychotics or other medications, antidepressants, but, you try to get Norvasc, which is for high blood pressure, that could cost anywhere from $100 realistically. And so knowing that information and giving that to other people is definitely a way to help to reduce that sort of anxiety and reduce that fear that there are resources out there. It's just a matter, you got to really look at the fine print, because they're not going to advertise them, right? But they are out there.
Yeah. The Walmart the Target $4 plan, the Walmart $5 plan, those lists of medications, a lot of them are generics, but the point still stands. Like, it's not a ripoff. They really do only cost that if they're on that list, and I know it's a short list. But I've done that. I've actually had patients where I've just switched them to medications that I knew for a fact were affordable, at least in the proper category. Maybe not my number one choice, but good enough. And that's the part that sometimes breaks my heart, where I'm saying I'm doing good enough when I know I could do better, but that's the way the system is set up.
Right.
So,
And
Brittany,
I think
thought
that sometimes it can help just to know there are those resources. Like there are tools that we can use. Sorry, my cat's having a moment. Like there are things that we will help you find. Like something I say to my clients is like, if this doesn't work, we'll try something else. Like it's okay. We will try other things. There are other tools that we can use. There are other resources we can look at. I think that helps to alleviate some of that anxiety. That's just like, if this happens, then that's it. I'm done. But like, there's so many more things that people just don't know are out there.
Right. And I agree. And there's so many people that don't know that, yes, you can get on Medicaid, especially if you lost your income. You now meet the income qualifier for it.
Right.
Or at least it's worth trying. And so a lot of people have spouses that are still making enough money that keeps them over the threshold, but people only look at the individual number and they don't always look at the family side, where they can be like, well, you don't have that income now, or so you do have the ability to meet that, and getting on to those plans are available to you. So like knowing kind of what your safety nets are would be a huge way to relieve some of that anxiety, to know that, yes, you're going to have to go and wait in line for 4 to 6 hours to be seen, and it's going to be stressful. And with COVID, I'm not even sure how that's working. Maybe they're giving digital things and letting people in at one at a time, and they have to wait in their car. I have no idea how DHS is doing it right now. But the safety nets exist, and you won't necessarily be without like your insurance totally. Like yes, like Doc is saying, you might not be able to take the same medication, you may not be able to see the same doctor, but you won't be left with nothing.
Right.
Ryan, I was going to say, I know Ryan, you had you had a point I think you wanted to make at some point, or
well, yeah, obviously, and Matt said this before, as the Avengers, we can't actually challenge the realms of government or industry. But Brittany, I thought, asked a great question, which is sort of what skills we can actually suggest for the people on the front lines, our patients, or people who might be our patients if they had insurance or if they had access, right? So for me, one of the biggest sort of skill areas that I've been working with my patients on during this time are a lot of different skills, obviously, but specifically DBT, or dialectic behavioral therapy skills, are fantastic during this time. You can go on Amazon and get a DBT skills for anxiety workbook. It'll be really basic, working on things like distress tolerance, mood regulation, interpersonal effectiveness, because if you're stuck in your house with your family, or if you're by yourself, like chances are there are going to be things that are going to be really difficult. And skills like radical acceptance, as an example, are really important during this time, just to kind of, you might ask yourself, well, I'm not pretending this isn't happening. I'm obviously accepting my reality. But, if we are, just to use some examples, watching Netflix all day or sleeping all day, not that those are unreasonable responses to this situation, but that is sort of non-acceptance, right? That's doing something other than what you would want to be doing to take care of yourself. So I think there's a lot of different skills.
Yeah. I've been having a lot of talks about what's the difference between something that's kind of like an avoidance or like a time killer versus like actually makes me feel pleasure and makes me feel good. And sort of like you're saying, like a big part of DBT, like you're saying, is like mindfulness, and like telling people like try different things and like, but actually think about how do you feel after you do it. Like whatever, if we're in a time period where you take an hour nap a day because you've been on Zoom for school all day or whatever, and your brain's fried, do you feel better after that nap, or do you feel like foggy and you don't want to get out of bed, and it actually makes you feel worse? And so it's kind of like paying more attention. I think that's been really hard even for myself, is like kind of losing track of like my routine. And like what I do day to day that actually makes me feel good. Because I think also part of, like you were speaking of, like the not acceptance pieces, I think a lot of people, not even necessarily clients, but like people I know in my life, are going to like a lot of avoidance tactics. It's like we just have to get through this time, and if I can just like be some form of unconscious for like most of it, and then I'll wake up and it'll hopefully be like, well, I'll be released. And so I think like being mindful of how are we spending our time, and just because now we have time on our hands, I don't know, I feel like people have been going two ways about it. Either they're going really hardcore into almost like despondency and like avoidance behaviors, or the super productive end of it, which I think we've also been seeing a lot on social media, which is we should use this time to write the great American novel or some stuff. And like, so I've also had to tell clients, like, it's okay to like not be that either. Like trying to find that sweet spot, I think, has been really difficult for everybody. And like I said, like myself included, I made a little chart of all the things I'm trying to do every day, and I color it, the little squares in to help me be mindful of like, what am I doing every day that helps myself feel good? And is it actually feeling good, or is this something I'm putting on this list, and when I don't complete it because I'm just not feeling drawn to it, am I feeling bad? You know what I mean? And I think like having that conversation with clients as well about like, what are we doing that's actually fulfilling us as much as it can be.
Are you in my head? I swear you're in my brain on a regular basis, because I'm not even going to pretend. I've been struggling. And I could say this, you know, I'm among friends and even the listeners. I've been struggling a lot with the situation. I am an extrovert, and I've been now working from home for over a month. And in addition, as many of you know, I have a young son who just turned a year old, April 1st. And my wife is a veterinarian, and she works 12-hour shifts, and her schedule was more of a 5-day-a-week thing. And then they shifted. So now she's out of the house 3 days a week for 12 hours, which means during those 3 days, I am solely responsible for taking care of my son, whom I adore and I love. He's the greatest thing that's ever happened to me. But I also have to work from home. And so I'm responsible for managing the household. I have to be responsive to the emails and phone calls that come in from my boss. And they are understanding to a point, but so if I don't get back to somebody for an hour, that's okay. But I can't just say I'm not answering emails today because I have to take care of Theo. And then he goes to bed, and then I have, maybe an hour to myself, and then my wife comes home and we get to spend maybe an hour together, and then she's exhausted from her shift, and then we go to bed by like 9:30, because that's just the life that we live now. And on top of this, my son is teething, so he's not even really sleeping through the night, and then he wakes up and he's screaming and crying, and takes an hour or 2 or 3, no exaggeration, to fall back asleep. And I never feel an opportunity where I can recharge, and it's made me break down on more than one occasion. Let me just put it that way. So there are times in which my son is not the only one crying in the middle of the night. And I'm somebody who, again, from stuff that I've learned from Doc and things that I picked up on the show, I'm somebody who knows these techniques and is at least aware of them, and I still can't practice them as effectively as I could or should.
Girl, I'm a therapist and I'm not practicing this stuff, so I would be. So I think another word I've been trying to remember, and I've also, some of my best stuff as a therapist, I steal from my therapist and then I regurgitate to my clients.
Also same.
Is like just self-compassion, and like hand in hand with mindfulness is like being compassionate. I think one thing I read that I've been thinking about all the time is like, we're not like working from home, like frou-frou, that's so fun. We're like, we are at home trying to work during a crisis. And so like, that's a very different way to think about it than the former. And so I think I've been trying really hard to, and I think that what flies in the face of the productivity part of it is like just being present with myself and what I need at any given moment. I don't have to be something magical, which I think also joins in with like my feeling maybe a little bit more insecure lately as a clinician, is trying to practice that self-compassion in those moments as well.
And I think
one thing I say to my clients all the time is leniency, empathy, and compassion towards yourself, in terms of, one, don't expect that your life is going to radically change and you're going to be super productive because you have so much more time. No, not going to happen.
This isn't a vacation.
Yeah.
No, it is not. And
It's
like
not a
we're
sabbatical
mentioning,
either. No.
right now, we are working from home, being a parent, a teacher, a spouse, and everything else through a crisis. This is not normal.
Yeah.
Human beings are not made to work this way. And there was a really good video by Dr. Ali Matu a couple days ago. I really recommend everyone watching it. And he says that humans aren't made to function this way. We need childcare. We need teachers in schools. We need to go to work.
We need each
Interact
other.
with people.
Yeah.
Exactly.
Yeah.
We are social creatures.
Yep.
And we can't function in isolation.
Like, like I'm an introvert and I'm even starting to feel a little.
Same.
Wow. Yeah. So as a fellow introvert, I will say that I haven't even had that situation because my job requires me to be at my office. But here's the weird thing. Because I have an administrative office in the hospital itself, it's best, according to them, it's best for me to do as much telepsych from my administrative office in the building, sequestered from everyone else, which means that I don't get the interaction with my colleagues and my peers and the nursing staff and everyone else, which I do enjoy. I actually love. I don't get to be home with my family, and my wife is pulling her hair out. My daughter is amazing. That's fine. But I'm just saying she doesn't get the immediate support from me. My daughter misses the bejesus out of me during the day and lets me know the second that I get home. I'm like, I feel like I'm getting the worst of all worlds here. This is so strange. And then on top of that, because of our format, we cut our hospital to the point where it's one person per room. It used to be 2 per room. So literally the census got cut in half at its max, which in theory lowers the workload. You would think that that is a good thing, except we have the number of providers for a typical workload. So now I'm flexing people. That's part of my administrative job. So now I have people where I have to say, by the way, you're taking some time off. You're going to take a day off this week. Right. And they're saying, no, I don't want that. So now I'm literally putting a burden on people that don't want it, in addition to not feeling comfortable in the position myself, on top of the idea that I'm not following what is my natural inclination on how I recharge. And so I'm wondering, and when I had to do this and make a schedule for it, I asked my bosses, I said, well, how long am I doing this? And I got blank stares. And that's the part that that was a realization to me, that it doesn't matter when it comes to whether or not we are quote unquote experts, whether it's mental health experts or business experts or anything. We are in the unknown.
Yeah.
Yeah.
And that's a huge source of anxiety for everyone. It's just not knowing.
Anxiety is the intolerance to uncertainty. And right now we're in completely uncertain times.
Right.
Right. And we're going through a collective trauma. I mean, I'm a trauma therapist, so I'm always going to base everything on what might be potential trauma first when I conceptualize it. But I've seen it over and over, and I think maybe that's part of Dr. Ali's thing too, or another person who published something similar, is that remember that this is a collective trauma. That we are all going through. This isn't a sabbatical. This isn't a time where we're all going to be in our best mind state and our most productive state, taking a break from work. No, we're doing all those things. I have a 2-year-old daughter at home. My wife is working at home. We're both trying to balance doing things. And we have a 2-bedroom condo in the city. I have to balance all of those things together. And some of the things that I'm working with clients on is the things that I'm trying to manage with myself is that the cognitive skills aren't going to work a whole lot right now. It has to get more into the body-based, how are you getting yourself into calm mind, calm body states?
We are at the bottom of Maslow's pyramid right now.
I just said that to somebody 2 days ago. So funny.
I've been going to basics with most of my clients on a regular basis in terms of, are you doing your breathing exercises, your grounding exercise, relaxation, or just basic anxiety management, DBT skills, mindfulness skills, let's just ride this wave.
Right. And I think that's hitting on, we're circling this word, this universality is what I've just been focusing on with all my clients, is just like,
same.
You are not alone. This stuff that you're feeling, Ben, I love that you brought up the collective trauma. I just did like a Zoom meeting actually for a bunch of like local business leaders, and basically like explaining to them self-care techniques. And I brought up the collective trauma thing. I equated this to 9/11 and how like this is a very different kind of trauma, but it's the same situation where we are collectively dealing with something that is way bigger than us, that is unprecedented. We have no idea what the rules are. We're all making things up as we go. And it's okay. And that goes back to that self-compassion thing, is just validating to yourself, it's okay not to be okay right now. It's okay not to know what the hell you're doing, because we don't either. No one does. And we're all trying to figure it out.
And the thing with this trauma, it's not one event that's happening and then it's done. It's
continuing.
One event and it's continuing, and it's getting progressively worse, and then it kind of tapers off. But things aren't going to go back to normal. Even when we have a vaccine, chances are it's going to take years before we go back to normal or a variation of.
Well, and that's one of the things that I've been discussing with just friends and family in general. And that's one of the things that I think we were discussing here is what is, I guess that's the last thing that we'll get into. What is the hope for you all of what the new normal is once this fades? What are some of your predictions or hopes, idealistically, realistically, whatever? What do you hope is the new normal after this fades? And we'll say in 18 months, I think is, if I could be 12 to 18 months, I think is realistic in the timeline for when we've reached a point that we're not seeing such a drastic uptick in new cases, that we're seeing things back to the point that, maybe only like worldwide, we're seeing like, less than 100 cases a day or a week, what have you. What are some of your hopes for what the new normal is after this?
I can go here.
One of the things that I love talking over Ben so much. One of the
I hate my co-hosts, just so everyone knows, like their existence, like in general. I love them, but I also squishing your heads right now.
One of the things that I just forgot the question.
The question is, what do we think our new normal is going to be?
Oh, that's right. Okay, so some of the hopes that I have.
Other than talking over Ben.
Shut up, Ben.
I do it so well, I don't have to work on it. One of the things that I'm hoping for is that that the access to mental health, that they do see that they do realize how important that is, that in some way, shape, or form, mental health. I don't have a hope that it's all going to be different, but man, it would be really nice to even just have the telehealth option not be fought in any way anymore. I don't know if that's realistic. Also, schools giving kids less friggin' homework. I can't deal with it. I have friggin' 12-year-old kids and 10-year-old kids who are checking their email and getting all stressed out. They're doing school on the computer from 8 till 3:30, and then doing homework until like midnight. Mm-hmm. Like a 12-year-old kid. And I think that's something that, and I also think that parents being at home with their kids and seeing what this is like and seeing how much stress their kids are under, I am really hopeful that the parents will, this is like a magical dream I have, that the parents will rise up and go to the schools and say, this is friggin' outrageous. You have got to stop doing this to our kids. The amount of kids that I am currently seeing who are feeling less anxious about school, I'm not even seeing them as much as I normally do, because it's like, oh, I'm doing school from home, so I'm fine. It's not, it's
for
so
a lot of people, their anxiety has gone down during the pandemic.
Yes.
I've also worked with a lot of people who have chronic depression and anxiety struggles. And I expected, I kind of was bracing myself oh, this is going to be a lot worse for them. And then they come in and they're like, no, this is normal. Everyone else is on my level now.
Like the movie Melancholia.
Yeah. I think I absolutely agree with that. So I think that's one of my hopes. And also just knowing that, and I think one of the things I've just been talking to clients about in general is kind of doing anything that helps you feel less anxious.
Mm-hmm.
Like, if you need to take your temperature every day, take your friggin' temperature every day. Like, it's not hurting anybody, and it's something that helps lower it just a little bit. So I think just trying to have anything, because I know that this last week was really, really hard for me. I was like laying face down on my couch, like screaming about how much I hate teletherapy. Even though I'm very, very grateful that I get to do it. And I'm really glad that I still get to see my clients in some context. But it's been really hard. I've had panic attacks. I haven't had panic attacks in like 10 years. Had like just kind of like cry at the end of every day. So like it's really hard. And I think just, again, that idea of being flexible with yourself in terms of what that looks like now.
Yeah.
But that's my hope for the future.
Yeah,
is that
I would say, I would say my hope for the future overall, speaking for healthcare providers, not just mental health, but overall, is the word that comes to mind is grace. Allow yourself the grace to not always feel your best 100% all the time, because there is this myth that as a doctor or whatever, that you have all the answers and you always have to do the perfect thing. And if you don't, then you're useless. And I think this whole situation has brought to a head something that I know I've noticed amongst my colleagues. I mean, like, whether you want to call it burnout, whether you want to call it moral injury, I've seen so many terms for it, but just the idea that somehow, and Anthony, I know you're going to see where I'm going with this, that somehow we were superheroes, and we need to stop treating ourselves that way. We need to make sure that we recognize that we are in this with everybody else the exact same way. And if we stop pretending, then we may actually be able to physician heal thyself. We just have never given ourselves, at least not in my training, at any point did we ever acknowledge that we were supposed to give ourselves that opportunity. And if there is something that in 18 months comes from this, the idea that doctors themselves are willing to say, like, you know what, right now I think I'm going through a depressed phase. I need to get this addressed and I need to reach out. Or my anxiety is through the roof, and, is there someone that that I could talk to? Whatever it is, if that becomes more of the norm, then I think that we'll have a much better system, regardless of what insurance companies say.
Well, I've been seeing a lot of support, certainly for the frontline workers, for at least the doctors and nurses on the front line. I know that there's been a lot of support for them, and I'm hoping that perhaps that bleeds through to the rest of physical health employees, mental health employees. Matt, I know you had your hand up. You wanted
and thank you for that perfect segue, because what I see it, especially now working on the medical floors within a hospital, that I really do. My hope is that they do see how important my function is. Because in my time in working in a hospital, I'll be honest with you, and I'm not trying to be, sad on purpose, but I've been told that my job is pointless. But now my job is crucial, because I'm the one helping to get patients out of the hospital safely, making sure they have everything that they need before they leave. And unfortunately now that includes making sure they have oxygen when they get home. So my hope is that instead of 3 social workers running a whole hospital, there will be 5 to 6 to 7 running or helping in the whole hospital. I really do hope that we're viewed as part of the team.
Essential, like we actually are.
That mental health is not elective, and it's not a commodity, but it's something that is crucial and essential.
Yeah. And it's not made
Absolutely.
up.
Yeah.
Yes.
It's not something that you can just go back to work or pray away.
Right.
Like, make enough money and you'll be fine. Pray it away. And I'd like to see some of that for me. Like, ideally, as a Thor-minded person, what I want is like everyone to see all the stuff we've gotten by standing up and saying no, and like take it like Thor when he had coffee, throw it on the ground and go another, and just demand the things from this society. We've gone and declared that we are getting this now. Like, I would love to see, because the stress of student loans being covered for 6 months without having to worry about it, like, that's huge for people like me that work for a government agency. Like, for all of these concessions to be made and all of these payments that we're not making to still count towards my 10 years, and that financial burden to be off of me because it's money that's made up from nowhere, that is being taken from us for because we're money factories, and seeing those kinds of things being taken away because everyone stood up and said no. And seeing people do that with when the insurance companies try to claw back the regulations they pulled back, trying to claw back on the things that they're paying for, trying to claw back the money that they've been bleeding out, that they're bleeding out now. And when they try to raise the premiums, and in an ideal world, I would see everybody stand up, and particularly in our society, those that do the negotiating of contracts and things, stand up in that room and say, we will not take this bull crap anymore. Like, this is nonsense. And we're going to stand up and say, all that stuff that you were able to give us during COVID, we want all of that all the time, guaranteed. No negotiation, no debate, nothing. Hammer down.
Right.
Well, I think to some extent you're going to have to ask your politicians and your representatives to fight for that stuff. And depending on where you live and who your representative is, you may have better luck conversing with the wall. But I won't get into that. Ryan, let's go to you. You've been quiet for a while.
That Ben took the superhero route, so I'll go that as well. Iron Man would try to find every possible technological solution. So even though we all acknowledge that telehealth is not a panacea, it's not a replacement for in-person therapy, there are a lot of great resources and opportunities here for technology to become something that's even more specifically focused on supporting our mental health, whether that's peer-to-peer networks, mental wellness applications, obviously telehealth. I'm excited about VR, AI, all of it. I want all of it. I want it as soon as possible. I want everyone who is, in the tech space and aware that we're experiencing a national shared trauma to recognize that this is going to become a real area of need over the next 6 months to 10 years, right? I actually work part-time for a company that does telehealth for employers, and this is the sort of side tag of that. I hope employers recognize that, even if you just want to put on profits, you will make better profits if your employees are able to stay at work because you're supporting their mental health. If that means you're just guaranteeing them 6 sessions a year, that's better than none. If you're guaranteeing them access to medication or to mental health coaching, there's so much stuff that's out there, and it's all going to be better than what we have now, which is to say not enough.
Very well said. I think that's about as good a place as any for us to end this. I mean, I'm sure we could continue for another several hours, but I think we've covered a lot of ground. One of the things I do love about this group is that everybody brings something to the table and everybody feeds off of everybody else's ideas. And what I hope that we all come away with is the idea for not just each other, but for our listeners that, and has been said repeatedly, we're all in this together and we all are here for each other, and that there are resources out both just for all of us internally. I think any one of us is willing and available at any point to lend an ear, to listen if needed for each other. And also I would put it out to the listeners of all of our respective shows that you are not alone, that you matter, and that there are resources out there. We are willing to help you. That is one of the reasons why we all do our shows individually. And certainly one of the things that, much like the Avengers come together to fight the enemies that no single one of us can fight, we all come together because this is bigger than any one of us. And so I hope that each of our listeners, whether you're listening to this on Capes on the Couch or any one of the other shows, that that there is help out there, and that whatever you're going through, you are not the only person going through it. And I'm not saying that to minimize whatever trauma you are going through, whatever you're struggling with. I'm not saying that to minimize it in any way, shape, or form. I'm saying that to prove to you that there are folks out there who can help you with it and who are willing to help you with it. And that's what all of the fine folks on this show are willing to do, be they professionals or not. We all do this because we care. And I think if nothing else, that we are continuing to show every time we come together that we do this because we care. And that is, sometimes that's all you need. And sometimes that's enough. And God willing, we can all get through this. And maybe by, as I said, on one of my previous shows, by the grace of whatever data you choose to believe in or not, that things will, whatever the new normal is, that we all stand up collectively and we help each other create that new normal. And it's something that's better for each other and for our listeners and for us as a species. Because I think this, we need to be mindful of that. This disease doesn't care who you are, doesn't matter what your income bracket is, who you voted for, who you pray to, what your blood type is, doesn't matter about any of that. It's killing humans. And at the end of this, we need to remember that we're all in this together as humanity. And anyway, that's, again, the naive idealist in me. But, I'm Captain America for a reason, I suppose. So.
Such a good speech.
Thank you.
Very good speech.
Thank you.
Bravo.
I try.
So
You succeed, sir.
So I will. I guess we'll wrap it up then with everybody plugging who you are and where they can find all of your shows and your social media. So I'll start. Doc Issues and I are on Twitter, both individually and collectively.
Come on, just say it's Capes on the Couch. I barely am on that thing. Come on.
Yeah, you are barely on Twitter. So Capes on the Couch on Facebook, Instagram, and Twitter. We have a Facebook group. We have a Discord. We have a Patreon. We have a TeePublic. There are any. Our email address is capesonthecouch@gmail.com, and our website is capesonthecouch.live or capesonthecouch.com. And really, if you just do a search for Capes on the Couch, you can find us. And again, we're so grateful to the rest of the Avengers for getting together and doing this. So I'll throw it over now to Ryan for Pop Psych.
Thanks. Yeah, you can find Pop Psych 101 everywhere podcasts are found and everywhere social media is found. Where I would say our biggest ones are Twitter and Facebook. So if you're looking for more content from us, at PopPsych101, you can also email us at Gmail, PopPsych101. So thanks so much for having me on this time. I hope we get to keep doing this.
Definitely. We'll love to have you back as schedules allow. Anna, you're up next.
Yes, you can find Freudian Sips Pod on all the podcast aggregating platforms. We're on social media. Freudian Sips Pod is our tag on basically everything. FreudianSipsPod.com, and you can find merch and links to our episodes and everything, all the cool stuff. And if you want to email us, we're FreudianSipsPod@gmail.com. All
right, and now Popcorn Psych.
So you can find us at Facebook and Instagram at Popcorn Psychology. On Twitter, we're at popcorn_psych. You can email us at popcornpsychology@gmail.com. We're always taking requests. We talk about movies, so we're always taking recommendations if anyone has one they really want to hear about. And I think, we're on Patreon as well if anyone wants to be generous.
Last but not least, Guardians.
We are Guardians MH. You can find us at guardiansmh.org, or you can email us at support@guardiansmh.org. We are a 501c3 nonprofit. We run a Discord group with hundreds of members and a very active mental health professionals team. It's been growing steadily over these past couple of weeks. We also have the RTS bot that you can integrate into your Discord server, which is giving you real-time support for mental health. And personally, you can find me at SSJ5Goku28 on Twitter. How about you, Matt?
I don't use any social media, so just find me in the Guardians Discord.
Smartest answer yet.
Hey, lucky you. Sometimes I find myself caught in a vicious Twitter cycle. So again, thank you so much to all of the Avengers. We appreciate all of your input. And I appreciate all of you assembling for this very important topic. And until next time, this is Anthony Sitko. Thank you so much for listening, and we will see you soon.
Bye.
Bye, everyone.
Bye.
All right, so I guess we'll cut the recording there, and then I guess next week we'll get this out. I don't think that this is going to make it in time for this week. Next Wednesday, I guess, because I like for all of us to release on the same day, roughly the same time, so that we're not cannibalizing anybody else's downloads. So,
all righty.
And kudos to Hannah and Brittany. You made it through an entire episode without swearing.
Yeah.
Friggin' a lot.
I did say friggin' a lot.
Yeah, you did say friggin' a lot, but I was like, okay, I can live with that. That's fine.
He tensed up every time you said.
Yeah, I'm sure.
Is it going to be now? Is it now?
Yeah.
So.
Okay, I'm glad
Thank
we
you,
have
guys.
that
Turn some lights on, by
It's
the way.
always-
It's
it's
dark.
always-
It's
No,
dark
we
as
like
fuck.
sitting in the dark like creeps.
Do you have like a fire going? Do you have mood lighting over there?
I have twinkle lights.
Oh, okay. It's like they have like a fire set. Oh man.
Nice.
Now Hannah's body's too hot.
Yeah. Yeah, we got problems. We gotta go.
All right.
Bye.
Thank you.
Y'all,
Okay.
have a good night. We'll do this again.
Yes.
If anyone wants to know, I don't know if you saw that Dr. Scarlett is holding a free superhero therapy class next Monday.
Nice.
Ooh.
All right.
So it's between 12 and 2 Eastern.
Okay.
So go follow her on Twitter, and you can get all the details there. Her class is amazing.
Will it be, if we can't make it, will it be available as like a webinar or something?
Possibly. You could reach out to her. Because I think she's condensing her 8-week class into like 2 hours.
2 hours.
Oh, wow.
Dang, dude.
Wow.
I highly recommend her class. I took it last year and got certified, and it's awesome.
Great.
Okay,
No.
guys. Well,
Well,
thank you
well,
so
awesome.
much for getting this all together, because it's always fun getting around other professionals and
Absolutely.
being validated a little bit.
Oh yeah.
I think this was
100%.
our best episode yet.
Mhm.
The last 45
discussion.
minutes were excellent.
Yeah, I think we hit on a lot of really good stuff.
Absolutely.
I don't think I'm not gonna do any editing. I may do like a little intro spiel, but that's about it. It's basically just going to be the entire discussion, just straightforward. And I guess we'll follow up on Twitter and in the group chat and figure out what the next topic is.
Great.
For the next episode.
Great.
Awesome.
I just got the recording for the first one, so we'd never released it. Did everybody else release that already? Because I'll get that out ASAP otherwise.
Okay. You lazy bastard.
It's not on it, so blame Hannah. But
Ouch.
Anthony, you're kind of mean when cameras aren't rolling, dude.
he just likes to
what?
give me
It's
shit like he gives everybody else shit. 'Cause he gives everybody else the run.
See,
He's like, I gotta get there too.
See, Ben says it, and everybody starts laughing. I say it, and it's like, oh, wow, we need to unpack it. Okay.
I think we should unpack Anthony's stuff too. I wasn't singling you out.
Doc, I'll be consistent. This is my first time here, so I'm going to leave.
Listen, there's the public side and the private side. Y'all are getting the
Exactly.
Now, well, I got to give credit to everyone for a very selfish reason. I'm going to watch this ESPN documentary,
Oh, yeah.
the Last
man.
Dance.
Oh, yes.
On the
Oh,
Bulls.
yes. Yeah. Yeah, my wife is upstairs right now. She's got it fired up. I was wondering how long this was going to run. I'm like, oh, this is perfect.
It's about to start, right? Yeah.
Yeah, I think I'm going to go jump on a Jackbox session that Kate from Ignorance Was Bliss is running. So
Which Jackbox?
I don't know.
Okay.
I'm going to log into Skype and see what the situation is.
Jackbox is amazing.
It's great.
Do you guys know about playingcards.io?
Yes.
Yeah.
It's a remote insensitivity.
Yes, remote
Yeah.
Cards Against Humanity. You can play with your friends or other card games for free.
Nice.
It's
Nice.
great.
.io.
Playingcards.io. Yep.
Okay, I will check it out.
Sweet.
Hi, guys.
All right,
Pleasure
everybody.
meeting
Okay,
everybody.
Yep.
You too.
Bye-bye.
Thanks a lot.
Welcome
Bye-bye.
aboard,
Bye.
Matt. Thanks.
Thank you.
Bye.